I was a brilliant surgeon. My hands moved with precision. I was a master of anatomy and surgical techniques. Yet, something was missing. I struggled to connect with my patients on a personal level. I saw them as cases, not individuals. I excelled in the operating room, but my interactions with patients were often brief and impersonal. I focused solely on their physical ailments. The emotional aspect of healing remained unexplored. I believed my surgical skills were enough.
Her colleagues admired her skills, but some found her distant. They noticed her lack of empathy. Amelia, however, remained oblivious. She was content in her world of scalpels and sutures. She believed emotions had no place in medicine. One day, a young woman named Sarah was admitted to the hospital. Sarah had been in a serious car accident. Her injuries were severe. Amelia was assigned to Sarah's case. She reviewed the charts and x-rays. The surgery was complex, but Amelia was confident. She had performed countless similar procedures.
I entered the operating room, ready to perform. I saw Sarah lying on the table. For a moment, our eyes met. I felt a flicker of something unfamiliar. Was it concern? It was quickly replaced by my usual clinical detachment. The surgery was a success. I had once again proven my surgical prowess.
However, Sarah's recovery was slow. She was withdrawn and seemed to have lost her spirit. Amelia, true to her nature, focused on the physical aspects of her healing. She monitored vital signs and adjusted medications. She remained oblivious to Sarah's emotional distress. Nurse Linda, a kind and experienced caregiver, observed Sarah's emotional state. She also noticed Amelia's detached approach. Linda decided to talk to Amelia.
Dr. Johnson, I think Sarah needs more than just medical attention. Emotional well-being plays a crucial role in recovery. Maybe you should listen to her fears and anxieties.
My job is to fix physical injuries, not to delve into emotions.
Linda persisted, reminding Amelia that patients were not just cases but people with feelings.
Patients are not just cases, Amelia. They are people with feelings. Try to see Sarah as a person, not just a patient.
Amelia, though hesitant, decided to try a different approach. Amelia began spending more time with Sarah.
I sat by her bedside, not to discuss charts or medications, but to listen.
She encouraged Sarah to talk about the accident, her fears and her hopes. At first, Sarah was hesitant.
I was used to doctors who only focused on my physical condition.
Slowly, Sarah began to open up. She shared her anxieties about the future, her nightmares, and her feelings of vulnerability.
I listened patiently, offering words of comfort and encouragement.
As Sarah shared, Amelia began to see her not as a patient, but as a young woman whose life had been turned upside down. Amelia realized the power of empathy.
I saw how my willingness to listen and understand had a profound impact on Sarah's spirit.
Sarah's emotional state began to improve. She seemed more hopeful, more engaged, and her physical recovery even seemed to accelerate. Amelia continued to nurture her emotional intelligence. She made a conscious effort to connect with all her patients, not just Sarah.
I asked about their lives, their families, and their fears. I listened with an open heart, offering support and understanding.
Sarah eventually recovered fully and was discharged from the hospital. A few months later, she returned not as a patient but as a volunteer.
I wanted to offer support to other patients going through similar experiences.
Sarah's transformation was a testament to the power of emotional connection in healing. Amelia's journey was far from over.
I continued to learn and grow, embracing the importance of emotional intelligence in medicine.
She discovered that true healing involved more than just treating physical ailments. It required understanding and addressing the emotional needs of her patients.
I had finally found what had been missing in my career: the human touch. Like and share this video from Marta Mental.